Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, The Future of Surgery, Robotic Advances with the Da Vinci System, presented by Dr. Karanthi Achanta, General Surgeon with Washington Health Medical Group. Since 2001, Dr. Achanta has been a leading general, laparoscopic, and robotic surgeon at Washington Health. He brings extensive experience across a broad range of general surgical procedures. He is dedicated to delivering patient-focused, concierge-level general surgical care at Washington Health. Dr. Achanta is a fellowship-trained and board-certified surgeon specializing in laparoscopic, robotic, and general surgery. Dr. Achanta continually enhances patient care through innovative, cutting-edge surgical techniques, such as robotics-assisted surgery, earning his Certificate of Da Vinci Technology training in May of 2024. Please welcome Dr. Achanta.
Hi everybody. Today I will be talking to you about the future of surgery, in particular the robotic advances with the Da Vinci robotic system. As you probably know, there are three different types of approaches to surgery. The oldest and the tried and true method is the open surgery, where instruments are held by the surgeon's hands and they operate through large incisions that are made in either the chest or the abdomen to get to the organs that need to be removed. Later on in the mid to late 1980s, we had technological advances where laparoscopic surgery became available. In laparoscopic surgery, the surgeon uses long, tiny instruments or instruments that are less than a pencil width in diameter through tiny openings in the chest or the abdomen, and surgery is performed through those openings. As technology further advanced, in the 2000s, we now have the robot that is available, and the Da Vinci robotic system takes this to the next level. It not only uses minimal instrumentation or minimally invasive techniques that we had in laparoscopic surgery, but it extends significantly the capabilities of the surgeon, the precision of the operation, and the clarity with which the surgery can be performed. Those are the advantages that the robotic assisted surgery allows us to perform in comparison to the open or laparoscopic surgery. We'll go a little bit more detailed about the robotic assisted surgery in the next few slides. Let's take a moment to understand the Da Vinci robotic system. The system has three components. The first part is the surgeon console. This is where the surgeon sits and controls the robot or the patient cart with four arms that the surgeon controls that actually performs the surgery. And the middle part is called the vision cart, which essentially provides the optics and the computer software to allow the robot to function, manipulated by the surgeon working at the surgeon console. So there are several misconceptions when it comes to robotic surgery. First, I want to make sure that everybody understands that the surgeon and the care team are in the room during the surgery. The robot does not perform the surgery independently on its own. The Da Vinci system allows the surgeon to manipulate its arms, but the Da Vinci system is not an intelligent system, and by that I mean it does not have independent thinking and independent movements. It does not do surgery independent of the surgeon. All of the four arms are controlled by the surgeon who's performing the procedure. What the robot does do is enhance the surgeon's capabilities. As I mentioned before in the previous slide, the robot does not have any independent thinking and cannot perform the surgery independently. However, the biggest advantage is that these instruments have very tiny and instrument tips that the surgeon can manipulate in tight spaces to allow the surgery to be performed. In fact, they have a higher degree of motion and range of motion than a wrist of a surgeon. If you can look at your own wrist, there are only a few ways that a wrist can move, and that's what a surgeon has when he is operating, whether it's laparoscopic or open surgery. Whereas robotic surgery allows the instrument to move in multiple different angles and degrees of motion. And I'll go over that in a different slide where we will demonstrate the dexterity of the robotic arms. The smaller arms allows the surgeon to operate in tight corners and tight spaces where there are important structures, particularly in the pelvis or in the chest. The other advantage that the robot allows us is it provides us a three-dimensional image that is magnified 10 times. So it's almost similar to operating under a simple microscope. So the clarity is significantly enhanced, as is the three-dimensional view, and it's magnified 10 times. By contrast, the laparoscopic surgery only allows us to see a two-dimensional image while we are operating on a three-dimensional person. So there are some technical skills that you need to master for laparoscopic surgery, whereas the robot allows us three-dimensional view of the person. Finally, the robot has one additional advantage. The robotic arms do not get tired, unlike surgeons' arms, and the robotic arms don't. They have a special technology where the tremor is filtered out. It's called the tremor filtration technology. So that even if there is a minor tremor or a shake in a surgeon's hand, it's not translated into the tip of the robotic instrument. And now we will demonstrate to you the dexterity of the Da Vinci system in this small video. You can see the arms of the robot picking up very tiny rings and placing them in a different location. You can see that the robotic arms are flipping. The arms are not colliding with any of the objects that are a crowded field, but the robotic arms are small and fine, and the range of motion, if I were to try to do this, I would be knocking on all of the other structures. So you can see how fine the movements of the robot are. Currently, the robotic Da Vinci system is being used in the cardiovascular field, where coronary bypass surgeries are being performed, or aspects of that surgery are being performed. A majority of the use is in colorectal, general surgery, where it's being extensively used in bariatric surgery, gallbladder surgery, and hernia repair, particularly large hernias and hernias that have come back after prior repair. The Da Vinci system is also being used extensively in gynecological surgeries, for hysterectomies, for fibroid removals, and for ovary removal, etc. It has a very big use in the thoracic surgery, where lung surgery and esophagus surgery is being performed using the robot. The Da Vinci robotic system is also being used to perform head and neck, especially base of the tongue surgeries, and urological surgery was and remains the main focus of the Da Vinci system in many healthcare systems, because they were the pioneers who started using the Da Vinci robotic system for robotic prostate surgery. So those are the areas that are currently using the Da Vinci robotic system currently at Washington Hospital. What to expect when having a robotic surgery? Very similar to other surgical procedures, your care team will review the procedure, discuss with you the pros and cons, and answer all your questions. And when the time comes for surgery, you will be brought into the operating room, and you'll be joined by your surgical team, both by the surgeon and the anesthesiologist. The Da Vinci Surgical System will already have been placed in the operating room. It will be sterilely draped. It is a different sight and sound for most patients who even had experience with surgery, because it occupies a large space in the room. That said, it's not threatening in any way, and it'll be tucked away into a corner, and for the most part, patients don't even realize that the robot is in the room. You'll receive the anesthetic medication so that you don't feel any pain, and you will be anesthetized, after which the surgeon will remain in the operating room, as I mentioned before, control sitting at the console and control the robotic arms, while the nurses and the surgical team are at the brains of the robot, so to speak, controlling the visuals and also controlling the other technical aspects of the robot. After the surgery, you will be moved on to the recovery room. And here I want to emphasize one of the biggest advantages of the robotic system is by the time you go to the recovery room, you will have very little or no pain associated with the surgery. The other major advantages of using robotic assisted surgery is a shorter length of stay. Many procedures that required overnight stay or prolonged hospitalization do not need that anymore with the robot. When we do robotic surgery, most of those patients, I would say in excess of 95% of those patients, are going home the same day. One of the bigger advantages of the robotic system is we do not lose any blood at all because of the higher degree of magnification and the clarity, the three-dimensional view. We don't lose blood at all, and the need for blood transfusion is almost virtually zero, I would say. I haven't had to transfuse anybody in over a little bit more than a year that the robot has been at Washington Hospital. Because of the stability, and the precision with which surgery is performed, there are fewer complications, and there are fewer deaths as a result of robotic surgery. And this has been borne out across the country at various centers over more than 2 decades worth of robotic surgery. And as there are less chances of complications, and with the robotic surgery, there are fewer readmissions for complications as well. That's all I have for you today, and I will take a few questions, and then we can wrap this up.
Thank you, Dr. Achanta. We do have a couple of questions. The first question is, are there potential risks or complications associated with robotic surgery?
So robotic surgery, like any surgery, does have complications, and things can go wrong. The main complications would be, again, like any other surgery, bleeding, infection, and injury to unwanted or unintended injuries. But as I mentioned before, all of those, bleeding, infection, and unintended or intended injuries, are significantly lower with the robot, because once again, the dexterity that it allows the surgeon, the visualization, the three-dimensional visualization, as well as the 10x visualization or 10 times magnified visualization. As a result, what happens is the incidence of complications is significantly lower than both open and laparoscopic surgery.
Okay, thank you. Our next question is, you touched on this before, but robotic surgery, how does it impact my recovery time and pain levels compared to a traditional surgery?
That's a very good question. And I can speak with more than a year of experience with the current Da Vinci system. The biggest difference we've noticed is when patients come to see us. We first noticed this about a year ago, when patients came back after surgery and they said, "Doc, I didn't use pain medications at all, or I've used only 2 pills of the 20 pills." As a result, we cut back on the narcotic use We are now prescribing significantly less narcotics, and as you probably know, narcotics have their own set of problems. In addition to having lots of complications such as constipation, there is potential for dependence, and we are trying to use less narcotics. And robotic surgery, that's the one biggest noticeable change that we saw in our patients, is they came to us and told us, we are not using pain medications, or we don't have to use pain medications. That's one advantage. As a result of that, where we used to give patients 2 to 3 weeks off after routine surgery, we are now able to allow them to go back to work within a week, sometimes within a few days even. So this has been a big change for us as well. This is what we noticed in our patient population. And this has been borne out nationwide as well in other studies and other centers.
Thank you. Our last question: how does robotic surgery compare to other surgical options in terms of long-term outcomes?
So robotic surgery will, in the near future, will replace open surgery and or laparoscopic surgery for the most part, because of the significant advantages and the future trends. If you look at the penetration of robotic surgery into community hospitals, and as new batches of surgeons are being trained with this technology, they are more comfortable, and they are finishing their training robot certified, whereas surgeons like myself had to become robot certified, and I became robot certified only a year ago. So now young surgeons are coming out fully trained, fully robotically trained and certified. As a result, as the technology advances, I see in not too distant future where most of the surgery is going to be performed using some kind of robotic system, because of all the significant advantages that it gives us.
Okay, thank you, Dr. Achanta, for this insightful presentation. This does conclude our program, and thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.